Good morning, Lake Providence Church family and friends. This is Dr. Linda Plummer Ward with another health ministry update. And again, thank you for joining today. So we're going to talk about vaccinations. Vaccinations continue to increase in the United States and around the world. Over 57 million vaccines have been administered in the United States so far, and the United States is currently administering about 1.8 million shots per day. The vaccines are administered by appointment according to different phases in each state. Different vaccines are being administered. They all prevent severe disease, they prevent hospitalization, they prevent ventilator support, and they prevent death. The best one to get? Well, the best one is the one that's available when you are eligible to receive it. It's uncertain at this time how well any of them will actually prevent transmission. That's being studied more. This is transmission because there's asymptomatic disease. That's what we're trying to find out now. So until then, we will continue to wear our mask, wash our hands, watch our distance, and avoid crowds. Talk to your doctor about vaccination. The health ministry can give you general information, but your doctor knows your medical history and can best advise you personally. Vaccines cannot give you COVID-19 infection. They don't contain the virus itself, they don't interfere with our DNA, and they do not cause infertility. Vaccines can cause side effects that are directly related to the expected immune response that occurs when we get the vaccine. It may or may not feel like flu symptoms. You may just get a sore arm. It may or may not limit your activity for a day or two. But it's not an infection. It's an immune response. It's what happens when our bodies begin to develop immunity. And if you get more symptoms other than that, something else is going on and that needs to be evaluated. Now, the immune response may cause some people to develop temporary lymph node swelling under the arm where the vaccine is given. On exam and on mammogram, this can be confusing when a person is being evaluated for like breast cancer. For this reason, it's recommended that mammograms be taken before getting the vaccine or 4 to 6 weeks afterwards. Now, if you feel sick, talk to your doctor. Get tested if you have COVID-19 symptoms, but postpone taking the vaccine until you feel well. If you tested positive for COVID-19, wait 30 days after the COVID-19 infection to take the vaccine. If you had COVID-19 and you were treated with monoclonal antibodies, wait 90 days before taking the vaccine. After the vaccine, again, we're going to continue to wear our mask, wash our hands, watch our distance, avoid crowds, increase ventilation, continue all of those public health advisements that we've been doing so far. You can monitor your health and the side effects after taking the vaccine in 2 ways, with V-Safe and with VAERS. V-Safe is V as in voice dash SAFE safe. After the vaccination, there's a V-Safe after vaccination health checker on the CDC website, or you can download the V-Safe phone app. Or you can report your vaccine response to VAERS, spelled V as in voice, AERS. And that stands for Vaccine Adverse Event Reporting System. It's a website, and the website is VAERS, VAERS.hhs.gov. The instructions for VAERS will be on your card that you get when you get the vaccine. Now, you should keep that very important card that you get when you get the vaccine. It has the date of your first shot, the approximate date of your second shot, and the manufacturer's information regarding your particular dose. Here's a short silent video that I'd like for you to watch that outlines what to expect after receiving the vaccine. Thank you so much for tuning in today. As always, stay safe, stay healthy, and stay prayed up.